Thanks for joining us. We're here today to talk about weight loss surgery at Cambridge Health Alliance. In this video, you'll hear about the disease of obesity. We'll also talk about treatment options, provide an overview of our program, and talk about next steps. You might know what obesity looks like and feels like, but from a medical perspective, obesity is a chronic disease characterized by excess fat storage with a number of related medical illnesses. We often use body mass index or BMI to determine if someone is obese. This is a ratio of height over weight. Just Google BMI to find an online calculator. People who have a BMI of 30 or more are considered obese, with different classes depending on how high the BMI number is. As doctors, we've learned a lot about obesity. We know it's usually progressive and potentially life-threatening, and there is no specific cure for the disease. Obesity typically impacts your quality of life and often shortens your lifespan. We also know there are many factors that cause or influence the disease. Some are genetic, some behavioral, and some environmental. You may have one or several of these factors. There are many serious illnesses related to obesity, too many to fit on one slide. We call these comorbid conditions. Some of them are type 2 diabetes, depression, heart disease, and sleep apnea. But there are many, many more. This can be scary, and we know it's a lot to consider. But by watching this video, you're taking an important step in your weight loss journey. And we have an interdisciplinary treatment team to help you along the way. This includes experts from the fields of bariatric surgery, endocrinology, psychology, nutrition, nursing, and more. These people all have special training in bariatric surgery and want to help others find better health. The team is led by Dr. Siva Vidyanathan, an internationally known and respected surgical leader who has more than 25 years' experience in bariatric and minimally invasive surgery. Over that time, he's helped thousands of patients, and he serves as an associate professor of surgery at Harvard Medical School. So, with all the weight loss options available these days, why should you consider surgery? Research shows that traditional weight loss methods have a high failure rate. It's hard to keep up with dieting and exercise, and the weight loss often only lasts about 6 months, so 95% of people don't sustain weight loss in the long term. Surgery tends to be more successful in the long term. People often keep the weight off for 10 years or more. But surgery is not right for everyone, and insurance companies often have eligibility guidelines. For example, you may be required to show you've tried other weight loss programs, that your BMI is over 35, or your BMI is over 30, and you have a related condition like diabetes, high blood pressure, high cholesterol, or heart disease, that you don't abuse drugs or alcohol, and that any psychiatric conditions are under control. And lastly, that you know the risks of surgery and are willing to follow the recommended lifestyle changes. You don't need to know everything, but you need to be able to make an informed decision about surgery and be aware of the changes you need to make to be successful in your weight loss journey. There's a pathway you'll follow through this process, and you're actually doing part of it right now. By taking this online orientation, you're one step closer to surgery. After this, you'll have an evaluation with a surgeon at the CHA surgical offices at either Cambridge or Everett Hospital. Once you've completed that visit, you'll get referrals to other services. You'll need to have an appointment with a nutritionist and see one of our psychological specialists for counseling. If you're someone who smokes or vapes, you'll need to be nicotine-free. Your insurance company will require testing. After all this, we'll submit your information to your insurance company to get pre-authorization for your surgery. Then, once we have insurance approval, we'll schedule you for pre-surgical testing and a pre-op teaching class, and we'll work to get you a surgery date. After surgery, we'll continue to see you. There'll be follow-ups with the surgeon's office and nutritionist, and you can be part of our support groups as you recover and continue your journey. Lots of people ask how long this all takes. Usually, it's 6 to 12 months. That's because most insurances require all the classes and testing be done before they'll give the approvals for surgery. For most of you, once you have pre-approval, you'll get a date for surgery within about 2 months. But it'll also depend on your ability to schedule and keep all your appointments. And you'll need to get treatment for any health issues we identify that could affect your surgery and get support to quit smoking if you need. It's also important to know that once you've completed all the steps, the final decision on surgery will be made by you and your care team. This is your journey. We're just here to support you. Not everyone who goes through the orientation will end up having surgery. For example, any women planning to get pregnant in the next 2 years shouldn't have surgery. This is because rapid weight loss after surgery can lead to a higher risk of neurological damage to the baby. As we mentioned, you'll be working with our registered dietitians before and after surgery. Before surgery, you'll learn about healthy eating behaviors, what you can eat and when after surgery, what supplements you'll need to take, and help with meal planning. These are the tools you need to find success after surgery and make your recovery as easy as possible. After surgery, our nutritionist will see you in the hospital and have follow-up visits with you to help you with your diet and guide you to make sure you get good nutrition as you experience weight loss. Okay, we've covered a lot of ground here. Let's switch gears for a minute and give you more details about the surgery itself. All our surgeries are done with minimally invasive technology, with a tiny camera and tiny instruments. This helps reduce healing times. We also use the Da Vinci surgical robot for our surgeries, the most modern surgical platform available. During the surgery, you'll be under general anesthesia. Then, most patients stay 1 night in the hospital, though some stay 2 nights, and you'll have some medications to take when you go home, like antacids, pain medication, and supplements. Also, some of your home medications might change after surgery, like blood pressure or diabetes medicine. Your care team will help make any adjustments to these. The CHA program focuses on 2 of the most common weight loss surgeries. The sleeve gastrectomy or gastric sleeve is what we call a restrictive operation, meaning it limits the amount of food you can eat. The Roux-en-Y gastric bypass offers some restriction and some malabsorption, meaning you don't digest your food the same way, limiting the amount of calories and nutrients you get from the food you eat. During a sleeve gastrectomy, the surgeon removes about 70% of your stomach. The remaining stomach is reshaped into a tube or sleeve that can't hold as much food. A smaller stomach means that you'll feel full after eating less. While there are many benefits, please note that this operation cannot be reversed. The good news is that this is a very common surgery, and many patients find success after having it done. Of course, with every surgery there are risks. You could have bleeding or infection, especially on the line where the stomach is divided. Poor healing of this area could cause your stomach contents to leak out, which can be very dangerous if not treated right away. So we need to work together to look for any signs of bleeding or infection as you recover. There's also risk of blood clots after surgery, known as deep vein thrombosis or DVT. When these blood clots are in the lungs, that's called a PE or pulmonary embolism, another very dangerous condition. And with a gastric sleeve, you may also see reflux, heartburn, or vomiting. Most of the time this gets better as patients recover, but it may require a further surgery to correct. Okay, now let's move on to gastric bypass surgery, also known as Roux-en-Y. Here, the surgeon creates a small pouch for the stomach and reroutes a section of the small intestine. This limits how much a patient can eat and also how food is digested. Some people consider gastric bypass to be the gold standard for bariatric surgery, and it's been done safely for over 50 years. With gastric bypass, no parts of the stomach are removed. The surgeon actually redirects the digestion flow, meaning that the food will no longer hit the big part of the stomach or first part of the small intestine. While most patients have an excellent outcome with gastric bypass, there are potential risks and complications similar to the gastric sleeve surgery we discussed earlier. For example, there are risks of infection and bleeding, especially along the new connections. Although it's uncommon, it's possible to have other problems with healing, like a rupture or leak or narrowing of the openings because of scars. These will require surgery or another procedure to fix. Also, because we reroute the intestines, patients with this surgery need to always take vitamins and supplements to stay healthy. But even with proper supplements, some patients develop low iron or low calcium after surgery. And lastly, some patients develop dumping syndrome when they eat food high in fat or sugar. In this case, you may feel sick, and it can lead to pain, nausea, vomiting, or diarrhea. These symptoms usually go away once the food passes through your system. Some patients see dumping syndrome as an advantage because it gives you extra incentive to stay away from certain foods. But it means you may never be able to tolerate these foods after surgery. So how do you choose what surgery to get? As you can see here, the expected excess weight loss with sleeve surgery is 50 to 60% and 60 to 80% with bypass surgery. Excess weight loss is simply a percentage of the weight you lose in comparison to how overweight you are. So if you have 100 pounds of excess weight, you should lose 50 to 60 pounds with gastric sleeve and 60 to 80 pounds with gastric bypass. Remember, this is just an estimate. Individual results will vary. We can also look at other health issues. A lot of weight loss patients have type 2 diabetes, and studies show that surgery is a great way to prevent diabetes complications. With medical therapy, less than 45% of patients show remission of type 2 diabetes after 2 years. But with surgery, 50 to 60% of patients have remission after gastric sleeve and 60 to 80% after gastric bypass. These patients might be able to get off their diabetes medication for good. Lots of people are also concerned about the risks of dying from surgery. That's valid, because we're doing this to live longer. The good news is that bariatric surgery is very safe, much safer than heart surgery, and even safer than common surgeries like gallbladder removal and knee replacement. The risks of dying from surgery are about 1 in 1,000. The complications we talked about earlier are also very uncommon. While we need to be aware of the risks and prepared to treat any complications, very few people have problems with their recovery. We'd also want to emphasize that the health risks of being obese are much higher than the risks of surgery. The American Society for Metabolic and Bariatric Surgery estimates that bariatric surgery can reduce the risk of premature death by 30 to 50%, with improvements in diabetes, heart disease, sleep apnea, and more. Before we let you go, we just want to emphasize again that surgery is a very personal decision. You need to do what's best for your life and your health under the guidance of a care team that you trust. The next step is for you to go to our website, challiance.org/bariatrics, or scan our QR code. Scroll down and click on Step 3, Contact Us, and then fill out our web form. Someone will get back to you with information and will set up an appointment for you for a consultation. Please remember to write down all your questions and bring them to the surgical consult. Until then, thank you. We look forward to meeting you and helping you achieve your weight loss goals.